1. A pharmacy technician is restocking medication and notices that hydrolysine and hydroxyzine are stored closely together. What is the best action to take? A. Move the bottles apart and use shelf labels to reduce the risk of LASA drug errors. B. Put a reminder note on your personal calendar. C. Assume the pharmacist knows what they are doing. D. Report the issue to the FDA. Correct answer is A. Move the bottles apart and use shelf labels to reduce the risk of LASA drug errors. Which of the following is a live vaccine that should not be administered during pregnancy? A. Hepatitis B. B. Varicella. C. Influenza. D. Tetanus, diphtheria, pertussis, Tdap. Correct answer is B. Varicella. This is a live virus vaccine and carries a theoretical risk of causing harm to the fetus. 3. Which of the following is true regarding the administration of ophthalmic drops? A. The patient should tilt their head forward. B. The patient should tilt their head back and pull down the lower eyelid to instill the drop. C. The patient should lie down for at least 30 minutes after. D. The patient should apply the drop directly to the cornea. Correct answer is B. The patient should tilt their head back and pull down the lower eyelid to instill the drop. This creates a small pocket for the drop and helps it stay in the eye. 4. The usual high dose of amoxicillin is 90 milligrams per kilogram per day for the treatment of an ear infection. What is the dose for a child weighing 22 pounds? A. 900 milligrams. B. 200 milligrams. C. 260 milligrams. D. 400 milligrams. Correct answer is A. 900 milligrams. Here is how I find it. First, convert the child's weight to kilograms. 1 kilogram equals 2.2 pounds. Then, multiply the weight in kilograms by the dosage. Which drug recall classification means that a product can cause serious adverse drug reactions or death? A. Class 1 recall. B. Class 2 recall. C. Class 3 recall. D. Class 4 recall. Correct answer is A. Class 1 recall. This is the most serious type of recall involving a reasonable probability of severe health problems or death.
6. Before compounding a non-sterile medication, what is the minimum amount of time a pharmacy technician should wash their hands? A. 20 seconds. B. 60 seconds. C. 5 seconds. D. 10 seconds. Correct answer is A. 20 seconds. This is the minimum duration recommended by the CDC and USP for effective hand washing. 7. Which of the following acts restricts access to private medical information and protects patient confidentiality? A. HIPAA. B. The Poison Prevention Packaging Act. C. The Kefauver-Harris Amendment. D. The Durham-Humphrey Amendment. Correct answer is A. HIPAA. The Health Insurance Portability and Accountability Act sets the standard for protecting sensitive patient health information. 8. How many clindamycin 150 milligram capsules are needed to compound 150 milliliters of a 100 milligrams per 5 milliliter liquid? A. 20 capsules. B. 50 capsules. C. 10 capsules. D. 25 capsules. Correct answer is A. 20 capsules. Here's the step-by-step breakdown of the calculation. Step 1. calculate the total milligrams needed. First, determine the total amount of clindamycin in milligrams required for the entire 150 milliliter preparation. The concentration is 100 milligrams by 5 milliliters. Step 2. Calculate the number of capsules. Next, determine how many 150 milligram capsules are needed to get the 3,000 milligram total. To do this, divide the total milligrams needed by the amount in each capsule. 9. What size of syringe should be used to measure 7.5 milliliters accurately? A. 25 milliliters. B. 10 milliliters. C. 20 milliliters. D. 15 milliliters. Correct answer is B. 10 milliliters. Using the smallest syringe that can hold the required volume provides the most accurate measurement. A prescription is written as albuterol 90 micrograms inhaler. Inhale 2 puffs every 4 to 6 hours as needed. The inhaler contains 200 actuations. What is the maximum day supply if the patient uses it every 4 hours? A. 15 days. B. 16 days. C. 25 days. D. 10 days. Correct answer is B. 16 days. Here is the step-by-step solution to the problem. 1. Determine the maximum doses per day. First, find out how many doses the patient can take in a 24-hour period. 24 hours divided by 4 hours per dose equals 6 doses per day. 2. Calculate the maximum puffs per day. The patient inhales 2 puffs for each dose. Now, multiply the number of doses per day by the puffs per dose. 6 doses per day times 2 puffs per dose equals 12 puffs per day. 3. Calculate the day supply. The inhaler contains a total of 200 puffs, or actuations. To find how many days this will last at maximum usage, divide the total puffs by the number of puffs used per day. 200 puffs divided by 12 puffs per day equals 16.66, etc. days. In pharmacy practice, the day supply is rounded down to the nearest whole number because the patient would not have enough medication for a full 17th day. So, the maximum day supply is 16 days. 10. Which federal law defined 2 specific medication categories, prescription and over-the-counter? A. Kefauver-Harris Amendment of 1962. B. OBRA 90. C. Durham-Humphrey Amendment of 1951. D. Food, Drug, and Cosmetic Act of 1938. Correct answer is C. Durham-Humphrey Amendment of 1951. This amendment to the FD and C Act created the 2 classes of drugs and required prescription drugs to bear the legend 12. In the National Drug Code, NDC, what do the first 4 digits represent? A. The drug manufacturer or labeler. B. The specific drug product. C. The expiration date. Or D. The package size. Answer is A. The drug manufacturer or labeler. This section of the NDC is assigned by the FDA to identify the company responsible for the drug. 13. A patient is prescribed oxycodone 5 milligrams tablets with instructions to take 2 tablets every 6 hours as needed for pain. The doctor prescribes a 7-day supply. How many tablets should be dispensed? A. 28 tablets. B. 56 tablets. C. 42 tablets. D. 14 tablets. Correct answer is B, 56 tablets. Here is the step-by-step solution to the problem. First, find the doses per day. 24 hours divided by 6 hours per dose equals 4 doses per day. Next, calculate the tablets per day. 4 doses per day times 2 tablets per dose equals 8 tablets per day. Then, determine the total quantity. 8 tablets per day times 7 days equals 56 tablets. Therefore, you should dispense 56 tablets for the 7-day supply. 14. Which of the following requires refrigeration? A. Amlodipine. B. Xarelto. C. Latanoprost. D. Warfarin. Correct answer is C. Latanoprost. Unopened bottles of this ophthalmic solution for glaucoma must be stored in the refrigerator. 15. What is the direction for the following SIG code? 4GTTS PO Q12H as UD. A. Give 4 drops orally every 12 hours as directed. B. Give 4 drops orally every 12 hours as needed. C. Give 2 tablespoons orally every 12 hours as directed. D. Give 1 tablespoon orally every 12 hours as directed. Correct answer is A. Give 4 drops orally every 12 hours as directed. GTTS means drops. PO means by mouth. Q12H means every 12 hours. And as UD means as directed. 16. Which of the following is considered the least sedating second-generation antihistamine? A. Diphenhydramine. B. Hydroxyzine. C. Cetirizine. Or D. Loratadine. The correct answer is D. Loratadine. This is a second-generation antihistamine that is less likely to cross the blood-brain barrier, resulting in less sedation. 17. Which medication requires a handling precaution where a technician should wear gloves? A. Insulin. B. Warfarin. C. Latanoprost. D. Methotrexate. Correct answer is D. Methotrexate. This is a hazardous drug, and special handling precautions, including wearing gloves, are required to avoid exposure. Number 18. Which book contains therapeutic equivalence codes to determine if a generic product can be substituted for a brand name product? A. Green Book. B. Red Book. C. Orange Book. D. Purple Book. Correct answer is C. Orange Book. Published by the FDA, this book is the primary source for determining therapeutic equivalence of generic drugs. 19. A patient requires a 2.5% lidocaine solution. The pharmacy has 5% lidocaine. How much of the 5% solution is needed to prepare 100 milliliters of 2.5% solution? A. 50 milliliters. B. 75 milliliters. C. 100 milliliters. D. 25 milliliters. Correct answer is A. 50 milliliters. Here's the step-by-step breakdown of the calculation. The most straightforward method to solve this is by using the dilution formula C1V1 equals C2V2. 5% times V1 equals 2.5% times 100 milliliters. 5% times V1 equals 250. V1 equals 250 divided by 5 equals 50 milliliters. To make the final product, you would measure 50 milliliters of the 5% lidocaine solution and add enough diluent, like sterile water or normal saline, depending on the formula, to reach a total final volume of 100 milliliters. 20. Which of the following correctly defines the generic name of a drug? A. Name of the therapeutic class. B. Name for the chemical structure. C. Name of the active ingredient. D. Name given by the manufacturer. Correct answer is C. Name of the active ingredient. The generic name is the officially recognized non-proprietary name of the drug's main component. 21. A pharmacy technician is compounding an ointment that requires mixing a solid ingredient into a base. What is the best technique to use? A. Levigation. B. Emulsification. C. Filtration. D. Trituration. Correct answer is A. Levigation. This technique involves wetting the solid with a small amount of liquid, a levigating agent, in which it is not soluble, then mixing it into the base. 22. If normal saline is to be infused at 100 milliliters per hour for 12 hours, what is the total volume of normal saline needed? A. 1,000 milliliters. B. 500 milliliters. C. 1,800 milliliters. D. 1,200 milliliters. Correct answer is D. 1,200 milliliters. We have total volume equals infusion rate times duration. 100 milliliters per hour times 12 hours equals 1,200 milliliters. So, a 1,200 milliliter volume of normal saline is required to run the infusion for the full 12 hours. 23. A pharmacist needs to dilute 1 gram of medication to make a concentration of 250 milligrams per 5 milliliters. What will be the final volume of the solution? A. 10 milliliters. B. 15 milliliters. C. 40 milliliters. D. 20 milliliters. Correct answer is D. 20 milliliters.
Here is step-by-step solution. 1. Convert units. 1 gram equals 1,000 milligrams. 2. Set up a proportion. 250 times V equals 1,000 times 5. 250 times V equals 5,000. V equals 5,000 divided by 250 equals 20 milliliters. Therefore, 1 gram, 1,000 milligrams, of the medication will create a 20 milliliter solution at a concentration of 250 milligrams per 5 milliliters.
24. What is the primary function of an antioxidant in a drug formulation? A. To improve the taste. B. To reduce the viscosity of the formulation. C. To enhance the absorption of the drug. D. To prevent oxidation of the active ingredient. Correct answer is D. To prevent oxidation of the active ingredient. Antioxidants protect the drug from degradation due to exposure to oxygen. 25. How much of a 1 to 500 ratio drug aqueous solution can be prepared from 10 grams of powder? A. 1,000 milliliters. B. 500 milliliters. C. 50,000 milliliters. Or D. 5,000 milliliters. Correct answer is D. 5,000 milliliters. Here is calculation breakdown. A 1 to 500 ratio means 1 gram of drug in 500 mLs of solution. 1 gram times V equals 10 grams times 500 mLs. V equals 5,000 mLs. So, 10 grams of the powder will be enough to prepare 5,000 mLs of the solution. 26. Which drug classification does citalopram belong to? A. Beta blockers. B. ACE inhibitors. C. SSRIs. D. Antihistamines. Correct answer is C. SSRIs. Citalopram brand name Celexa, is an antidepressant classified as a selective serotonin reuptake inhibitor, SSRI.
27. How many milliliters are in 5 ounces? A. 120, B. 130, C. 140, D. 150. Correct answer, D. 150. The standard conversion is 1 ounce equals 30 milliliters. Therefore, 5 ounces multiplied by 30 milliliters per ounce equals 150 milliliters. 28. What is the drug name a manufacturer gives to a drug? A. Chemical name, B. Generic name, C. Brand name, D. NDC. Correct answer is C. Brand name. The brand name or trademarked name is the proprietary, trademarked name a manufacturer gives to its product, such as Tylenol. The generic name is the active ingredient, such as acetaminophen. 29. Which of the following controlled drugs cannot have refills? A. Ativan, B. Tylenol number 3, C. Norco, or D. Lyrica. Correct answer is C. Norco. Norco hydrocodone acetaminophen is a DEA Schedule II medication. Prescriptions for Schedule II drugs cannot be refilled. A new prescription is required each time. 30. What DEA schedule is Adderall? A. 1, B. 2, C. 3, D. 4. Correct answer is B. 2. Adderall is a stimulant with a high potential for abuse and is classified as a DEA Schedule II controlled substance.